Thank you, Dr. Shordash. So, hello everyone. My name is Suhani Pawar, and I am the Vice President of Events for Students for Global Health. I just want to say thank you to everyone for attending our winterly quarterly conversations. And I want to first start off by introducing Caitlin Chan, our program intern for iHouse, and she's going to say some things about Global Forum programming.
Thank you. Hi, everyone. My name is Kaylin Chan, and I serve as one of the iHouse program interns for this term. And I just want to also, again, welcome you guys all to a Global Forum on behalf of iHouse. Just to reiterate, for those who don't know, Global Forum is a space program we do to kind of introduce and speak about global topics and basically bring a safe space around to discuss these sort of things. And so, yeah, we just keep it brief, but thank you very much for coming, and we look forward to having you.
Thank you. So before we start with our presenters, I'm just going to do a quick land acknowledgement. Thank you to the Intertribal Resource Center for this. The UCSD community holds great respect for the land and the original people of the area where our campus is located. The university is built on the unceded territory of the Kumeyaay Nation. Today, the Kumeyaay people continue to maintain their political sovereignty and cultural traditions as vital members of the San Diego community. We acknowledge their tremendous contributions to our region and thank them for their stewardship. And before we begin, we wanted to highlight some exciting Global Health Program events and upcoming deadlines. So we have our Schedule for Success event with the Students for Global Health Board and our Global Health Program Advisor. That's going to be Tuesday, February 10th at 5 p.m. And we have our MA deadline for a Master's in Global Health. That application deadline is also February 10th. We have international field experiences. The AIA scholarship application opens February 17th, and the Horizons Research Symposium is Wednesday, June 3rd. More information about these events will be upcoming in the Global Health Program newsletters. Additionally, for Global Health courses that are receiving extra credit, your QR codes will be up once the event concludes. And in an effort to conserve paper, please use this QR code to access our events brochure. And I'm going to bring up the afternoon's MC and the Global Health Program Director, Dr. Thomas Shordash, to the stage.
Thank you very much, Suhani. I am Professor Tom Shordash. I'm the Director of the Global Health Program and a professor in the Department of Anthropology. Welcome, all of you, to our winter quarterly conversations in global health. Quarterly Conversations in Global Health is a regular installment of our global health activities here at UC San Diego, and it's made possible by the Global Health Program, Students for Global Health, the Center for Global Mental Health, and the Global Forum. As with all our events, the goal is to bring the global health community and the local San Diego community together to discuss important issues in the field. Before we begin, we'd like to thank our co-sponsors and individuals who have made these events possible this quarter. Thank you very much to the Students for Global Health, the Global Health Program, iHouse, the Center for Global Mental Health, and the School of Social Sciences for providing support and sponsoring this event today. We also want to give a special thank you to the Global Forum and their staff for providing the space for our event today here at the Great Hall. Finally, we'd like to thank the Events Committee led by Global Health student Suhani Pawar and Rebecca Sahagun from UC San Diego Students for Global Health, as well as our Global Health advisors Jane Eichhorst and Brittany Wright, all of whom contributed to putting together this afternoon's conversation. And we are especially pleased to have Brittany with us today because she's not always able to attend. Welcome back, Brittany. We want to highlight our tabling organizations that are taking part in providing info to event attendees today. We'd like to thank, again, Students for Global Health, the Career Center, the Global Health Program, and the UC San Diego Center for Global Justice for tabling with us today at our event. We encourage everybody to stop by their tables to find out about upcoming events and ways to get involved And we're always especially grateful to the tabling organizations because part of what we try to do here is literally establish a broad conversation and get people involved in networks. In addition to getting involved with the organizations joining us today, we highly encourage students to apply to become UC Global Health Institute ambassadors. The UC Global Health Institute is an organization that encompasses all 10 campuses of the university, and the ambassadors program is a special opportunity for those who are really committed to global health, not only to learn about issues that the UCGHI is deeply involved with, but also to connect with other people at other campuses. The ambassadors usually comprise around 30 students from all of the campuses, and it's, again, a great opportunity to expand your networks with people who are as passionate about global health as you are. The applications are due during fall quarter every year, and global health majors and minors are notified when the application opens via email and via the Global Health newsletter. We also encourage everybody to sign up for the UC Global Health Institute newsletter to stay informed about opportunities and events. And I also want to draw your attention to and make a special plug for our own Masters of Arts in Global Health program, which we are currently taking applications for up until, I think it's February 10th. The Masters of Arts in Global Health is a highlight of our program. It's a one-year master's program. I encourage all of you who are seniors to take a look at it and take a look at the information that's on the website about it, because it's a chance to advance your thinking and practical knowledge and theoretical knowledge about global health in an intensive year-long program that prepares you for the next step in your career. And our Masters of Arts in Global Health students go in a lot of different directions. Some of them go into PhD programs relevant to health in global health and global health sciences. Some of them go into the health sciences, to medical school, to nursing school, to dental school. Some of them go into policy training or law school that has to do with health issues. Some people, based on their experience in the MA program, go on to work with NGOs relevant to health. And some of the people you're going to hear from today are not only alumni of our bachelor's programs, but alumni of the master's program. So the topic we're exploring this quarter is Global Health Alumni in Action. All of our speakers are UC San Diego Global Health Program alumni: Segan Zarai, Zoe Slipper, and Andrea Villanueva. Each speaker will have 10 to 15 minutes to introduce themselves and present. And I will briefly give introductions to each of them. Our first speaker, who we're pleased to have back, is Segan Zarai. She holds a BA and an MA in Global Health from UC San Diego. Her academic work has centered on the health outcomes of displaced refugee youth from East Africa. As a first-generation Eritrean American and former war refugee, she brings lived experience and a commitment to a culturally responsive, trauma-informed care and health equity. She currently serves as a project manager in UC San Diego's Refugee and Immigrant Health Unit, supporting community-based research, program development, and outreach in partnership with the San Diego Refugee Communities Coalition. Segan, it's delightful to have you with us today. The podium is yours.
All right, good afternoon, everyone. My name is Segan. Thank you so much for having me. I'm really excited to be here and just share a little bit about my experiences. So just really quickly, I just wanted to begin with a bit of background because my personal journey has really shaped a lot of the work I do in the field, which I know is true for so many of us. So I came to the States, as mentioned, as a war refugee in the early 2000s. I'm originally from Eritrea. I was born in Ethiopia and sought asylum in Kenya with my family, and this was all during the Badme border war conflict in 1998, which was when I was born. So experiencing war conflict and displacement as a child really taught me early on that health is never just isn't just siloed into a clinical sort of thing. It's shaped by so many different systems and whether or not people are seen protected and cared for within these systems. And it also taught me really early on how important it is to rely on community and support networks to navigate all those challenges and to be able to thrive. And this lesson really continues to guide a lot of the work I do in the field today. So later on, after we settled in the States, my 4 siblings and I were raised by our single mom, and I became the first in my family to graduate from a 4-year university. And as was mentioned, I earned my BA in global health back in 2020. And as a child as well, my grandfather, he was a physician back home in Eritrea, and he helped so many people, so that was sort of like the catalyst for getting into health in general, but it was really the global health program that was able to put a name to what I actually wanted to do with health. And so that's really, continues to inspire me today. And also the program really helped me realize that my lived experience had a rightful place in academic and policy spaces. So all this really shaped my research interests, which were noted prior, but just more mental and clinical health outcomes of displaced Eritrean refugee youth, especially unaccompanied refugee minors, their attachment styles, as well as community resilience. So after earning my BA, I spent a year working in nonprofit settings and spent a lot of time supporting refugee newcomer youth, and that was really fulfilling for me and I think affirmed my interest and passion for community-centered work. I then returned to UCSD to do my Master's of Arts in Global Health. I was part of class of 2023. And a little bit about the coursework, it covered everything from policy, research, program management, medical anthropology, and community health, to just broadly name. And the small cohort model was really encouraging for more mentorship-based dynamic, which was really helpful. I also had the opportunity to serve as a TA, and so I ended up getting to mentor 2 of my own community members through their own applications, which was really rewarding for me. So after graduation, I spent about 9 months searching for a job, and this was really challenging, and I know this is something that many people can relate to. And so I had to rely again on community, on my cohort members, especially since recently we know that the job market has really shifted, and this was a really draining process. And there's almost a point where I didn't apply to my current role, but thankfully things definitely shifted, and it turned out to be the right opportunity for me, which I will get more into. So I now work for the UC San Diego Refugee and Immigrant Health Unit, which is housed within the Center for Community Health, and that is broadly under the Altman Clinical and Translational Research Institute, which is always a mouthful, but some other units we have within our center include the Child and Family Health Unit and the Food Access and Equity Unit. But just a little bit about the Refugee and Immigrant Health Unit. Our mission is to advance health equity and well-being in refugee and immigrant communities through culturally responsive approaches, and our vision is thriving refugee and immigrant communities that are embraced by equitable and inclusive systems. So the work in our unit really spans research and evaluation, program development, coalition and capacity building, and community engagement. So with this, I got to focus a lot on areas that I care deeply about, like data evaluation, which I never thought I would enjoy as much as I do, but It's been really amazing to see the impact of it on the community, especially community ownership over their own data, which is really important. And also health policy advocacy, refugee maternal health. And one of the programs I helped pilot includes the community doula program, which trains immigrant refugee community members to become certified and licensed doulas. And for context, doulas are basically non-medical delivery and labor support people. So we build up the workforce in the community while also improving access to culturally affirming care for our immigrant patients where there's a real need. And to share some positive news, we recently got our IRB accepted to launch a research study on the impact of this program, but it also helps fill the gap in the literature around linguistically congruent doula care for our refugee immigrant communities, which is a first of its kind initiative since there's not really any existing data out there that represents this. So other focus areas of mine include managing internships for my unit, also youth engagement and mentorship, which really ties well with some of those academic research interests I mentioned earlier, and also behavioral and community health. And we've actually done some partner work with Dr. Walkover with one of our community health worker programs, which was really exciting. And all of these areas center community voice, experience, and leadership. And we do a lot of our community engagement through the San Diego Refugee Communities Coalition, or SDRCC, which was co-founded by my director, since a lot of the community orgs in San Diego do a lot of the same work, but they're competing for much of the same funding. So in order to sort of minimize a lot of the negative outcomes of that, this coalition was created to streamline that shared funding and also build capacity, and there's always strength in numbers. So it's about a dozen different orgs that serve diverse groups within our refugee and immigrant communities. And we also lead some statewide work with our refugee school impact and youth mentoring programs, and we do this in partnership with the California Department of Social Services and the Public Health Institute, and some other sort of specific areas also include supporting policy advocacy for our community. So a lot of our SDRCC community members have championed bills that the governor recently passed into law, such as the MENA Inclusion Act, which formally recognizes Middle Eastern and North African communities in state data collection. And this was championed specifically by the Mujdal Arab Community Center in our coalition. And then the Medical Debt Prevention Act, which promotes patient pre-screening for financial assistance before care. And I also want to highlight Noon in the audience. She's a huge, sorry to put you on the spot, girl. She's a huge advocacy lead within our whole coalition, and she's champions a lot of this work and manages like district visits, and yeah, she's incredible. So I just want to shout out to Noon. Yeah, she's such a leader in so much of this work, and it wouldn't be possible without her leadership. But yeah, so all of this is a really great reminder that collective action with community at the helm is really at the heart of meaningful change. And if you'd like to dive deeper into our work, this QR code links to some of our reports and publications, which I can also share after the presentation. So my role required a graduate degree in global and public health, so the knowledge I gained at the MA and BA programs have been really just directly transferable and applicable. So learning skills like stakeholder engagement, interdisciplinary teamwork, the importance of building community partnership and community-based participatory research, health policy advocacy, project management, social determinants of health, and cultural humility were all really valuable to what I do just regularly within this role. And the program really gave a lot of systems level perspective, which was really helpful in seeing how local actions connect to a lot of those broader global health challenges. And then as far as advice, a lot of this you guys I feel like already carry with you, so I'm just affirming what you already know, but to begin, I just want to uplift that your existing skills are valuable. You're constantly learning to work with diverse groups, meet deadlines, and manage projects, which are all foundational and transferable from school, work, internships, and life overall. And this next one was really huge for me personally. The idea that it's okay to pivot away from expectations into something that aligns better with you. I feel like this is really necessary for growth. I was a human bio major before, and so the switch to global health, I think, was super important for my journey. And again, it's really because I found a name for what I actually wanted to do in health, and the program really helped in realizing that. And then, of course, prioritizing your well-being, mental and physical health is really important. What really helps me is considering like a personal reward system, even something small like enjoying like a midday matcha or like your favorite food, I feel like is always really helpful. And then when I was a student, something more large scale, like looking forward to something at the end of the quarter, whether it was like an event or like a concert or something, I felt was really helpful. And then keep building and exploring, so strengthening your network, discovering your interests, and using any available resources, especially within the global health program. Even having one helpful sort of conversation or tool can really make a difference, which you're already doing by just being here. And I myself, I'm more on like the introverted side, so it was always harder, I think, for me to approach people, which is why I would also like to share that I really do care about being a support to others, especially young people in the community. So if you ever do, need anything, feel free to reach out. I'm happy to offer any guidance I can. And at its core, this work is really about coming together, which is why I also want to leave you with this final note. So this is an Eritrean saying from our War for Independence. It says, Awat Nahafash, which highlights the value of freedom. But to me, it's a reminder that meaningful change, whether in health, policy, or community, never happens alone. And earlier I shared that experiencing conflict and displacement as a child taught me that health is shaped not just by clinical care, but by systems, policy, and whether people are truly seen and protected in those spaces. And achieving that lasting impact requires community collaboration and people choosing to show up for one another. And everyone in this room or who's in this field or something similar, I feel like already carries a heart of service with them. So I feel like it does take like a special kind of person, especially young people, to fully dedicate themselves to work that champions empathy, truth, and justice. So I'm really thankful for pathways like the BA and MA Global Health programs for shaping and guiding us into this work. So again, it's really through listening, mutual support, and uplifting our communities, especially now in a time when there's lots of fear, where we can really create those conditions for equitable systems to thrive. And with that, thank you all so much for listening. Feel free to connect with us. These are some of our socials. And then if you scan this QR code, it also links to signing up to receive our newsletters, which also shows sort of up to date as far as like programming and all the work we're doing. Yeah, thank you.
Thank you very much, Segan. That was a fantastic glimpse, picture of your pathway from being a refugee to your educational experience and now on to your professional experience. That was a fantastic presentation. Our next speaker is Zoe Slipper, who is a health promotion specialist at San Diego State University, where she provides contraception counseling, STI, STD education, pregnancy options counseling, and broader sexual health education. She earned her BA from UC Davis and her Master's of Arts in Global Health from right here at UC San Diego. Alongside her work in sexual and reproductive health promotion, she's committed to advancing migrant and immigrant health and well-being at the San Diego-Tijuana border. Please welcome our very own Zoe Slipper.
Hi everyone, I'm Zoe. Most of my presentation is pictures, if that's okay. Hopefully it stimulates our senses. But I thought I would do mostly just talking and pointing at pictures today. So thank you so much for having me. It's such an honor to be here. Like Dr. Chordash said, I graduated in the 2024 cohort. And so I'm so happy to be back. Not much has changed, but also so many things have in the same way. So it's really, really neat to be back and to see everyone again after a couple of years. So starting with some pictures, this is kind of a bit of, I guess, a timeline in photos. So starting with the black and white photo, that's when I graduated in 2022 from UC Davis. I was just at my friend's house, so that just happened to be taken because it was so hot at the ceremony that we literally had to leave, and so I couldn't actually walk the stage. So we walked in front of the friend's porch, so that was good enough for me. And then I have a couple of photos. The middle one is from HFIT, so Health Frontiers in Tijuana, with some amazing students in the Global Health program, as well as Dr. Burgos, who's actually pictured in the far right-hand corner as well. And my wonderful co-TAs as well are pictured in these photos too. I have my research that was formulated essentially through working with actually Dr. Chordash and Dr. Wilson in the Tracing Asylum Seekers Experience and Trajectories research project. And so I was lucky enough to work with them to develop my independent research study in the program. So that's shown there. And then I got to graduate. So those are just some celebratory photos as well here at UCSD. So kind of just jumping into my life in building blocks. I kind of like to see it that way because I feel like it all started with the foundation of getting my bachelor's of art in international relations and then my minors in public health and Spanish. I like to say I kind of just tied those all together and put a bow on it and pursued global health to kind of wrap it all together. But this was a really sort of foundational experience in experiencing different issues and learning about issues in public health and gaining a better and more comprehensive understanding of different cultures and also practicing my Spanish and perfecting that as well. So that was a great opportunity at UC Davis. And then in the green sort of block, that was mostly comprised of my internships and different volunteering that I did as well at UC Davis. So I have a lot of things noted, so I'll kind of just briefly run through them. But in the Sacramento County Health Center, I served as a community resource specialist intern on the pediatric floor, and that was a great experience sort of working with families to connect them to resources. So starting health work on a community level was really a great catalyst for sort of being in a clinic and understanding I wanted to do public health work and work in clinics. So that was my sophomore year of undergrad. And then I later on went to become a volunteer for Planned Parenthood Federation of America, where I became more passionate about reproductive health and justice and also racial justice and racial politics that are bound to reproductive health as well. So I was lucky enough to also host teach-ins on a national scale because it was on Zoom. So kind of another perk of the pandemic otherwise. And then lastly, I have also volunteered for the International Rescue Committee. Maybe some of you are familiar with that, based in San Diego. And I also worked in the University of Barcelona when I studied abroad there in my undergrad. And in both of those positions, I worked as an English second language teacher for different students. At the IRC, it was mostly women and a lot of refugee and migrant families that would come in. And then University of Barcelona was just the Spanish students that I was lucky to work with. And then just to kind of give you context of like the different paths I took, but that all kind of led me to global health at the very top. I later on started my journey at UC San Diego actually as an undergraduate housing services coordinator. So I connected undergrad students to housing, and that's when they were opening up, I think it's 7th college or one of the newer colleges. So that was very fun to get all the students in there. And then finally, I came to the master's program, and I was able to have these amazing research and internship and volunteership opportunities at UCSD. So some of those were working as a TA, one of them for Dr. Viorino in the audience as well, and reader, also for Dr. Burgos, and a graduate research assistant with the TACIT project, or Tracing Asylum Seekers' Experience and Trajectories. And then HFIT, as I mentioned before, the Health Frontiers in Tijuana clinic program as well, where students would actually go into Tijuana and work in those clinics. So that was a great global experience that was pretty much just in our neighborhood, more or less. The fact that we could walk across the border was a great privilege and honor to be able to work with those students there as well. And then lastly, I did have an internship as well that was based in Barcelona, but it was virtual. So I was able to do my work here at UCSD for a female health company. It was called Happy Sneeze. It focused on pelvic floor health for postpartum folks. So that was a great sort of intro to reproductive health as well. And yeah, that's a little bit about me and my background. So just kind of expounding on the internships and volunteer experience. That's a picture of me in the clinic. It's a selfie, so it's kind of silly, but this is what it looks like sort of crossing in to get to the clinic. So sort of a cool visual to see for folks maybe that haven't experienced HFIT yet or wanting to. And then Happy Sneeze is the company that I worked for, so I included the logo. And then I don't know if you all know Professor Rad. I believe she may have walked in just now as well, but it was great working with her as well, Professor Rad Bavzar. So that was, this was a great opportunity actually with a wonderful program, Global Communities, that had a gala, and I sort of was reached out to by Professor Rad to see if I wanted to volunteer, and it was a really wonderful opportunity to meet some actually cohort members of the Global Health Master's Program at the time. So it was the 2024 cohort. So I think a lot of these folks in this photo were either undergrads or grad students at the time. So really wonderful for networking. And I'll get there, but I wanted to include that because I think this program is really special. And whether you're an undergrad or a grad, to sort of build these bonds with folks that have a shared mission to improve health equity and have a passion for improving health outcomes on both a local and a global scale. So saying yes to different opportunities. I know that this is for career development that I'm here today, and I know a lot of you are probably asking questions to yourself like, what are my next steps? So this was something that I did actually post-graduation, and this was a great opportunity to kind of stay close to the program, but also to network with some other folks that joined it. Okay, and so now to my professional experience. So I currently work at San Diego State University in the Wellbeing and Health Promotion Office. I serve as a health promotion specialist, it's called, but we're essentially a team of public health specialists that focus on a variety of topics for the students. So there's about 6 of us, and I focus on sexual and reproductive health for the students. And so tapping into things like one-on-one office hours with students if there are any questions about their personal health journeys. I work really closely with the Student Health Services in, we call it the Cal Poly Center, is where sort of all the health departments are housed. And so they're located on the 1st and 2nd floor. So I serve as a sort of a liaison between myself and the different nurses and doctors that are able to provide the care that I'm able to educate the students about. That's a little bit about what I do. It's mostly program management. So I am the lead program manager for the sexual and reproductive office. So I oversee an intern and multiple undergrad students. So there's always something new every day. It's health promotion work, and so it's a lot of just educational outreach and getting our name out there and enriching the students about how to keep themselves healthy and safe. And yeah, it's a lot of fun work. I love working with undergrad students on a daily basis. So the second thing that I forgot to mention was actually before I started this current position as a health promotion specialist was serving as a graduate research assistant on the team with Dr. Chordash and Dr. Wilson in the Tracing Asylum Seekers Experience Trajectories. So this was a wonderful project that was essentially an ethnography of care that focused on the pre-migration, migration, and post-migration process for asylum seekers through the Mexico to US border. And so essentially what our team did was we wanted to better understand the psychosocial sort of impacts of border crossing at the US-Mexico border. And so we were looking at things like illness and injuries, and more specifically, we were looking at border wall falls for the migrants at the US-Mexico border. And so that was a wonderful experience where I was able to actually interview asylum seekers at different migrant shelters in San Diego, and was able to practice that ethnographic research and qualitative data analysis that I still use today in a lot of ways in my position, but in a different topic. So yeah. Here's a little bit more, just more visuals about my professional work experience at SDSU. This was my team. This is my team. I guess just one of them we've replaced since then, but there's 6 of us. We all, again, focus on different topics. So we have alcohol and other drugs education, and then we have recovery. That's kind of someone that works hand in hand with that position to help students recover from misuse of drugs and alcohol. And then we have a sexual violence prevention specialist, health literacy specialist, and then we have a registered dietitian in our department that focuses on nutrition for the students. So we are a nice, diverse group of people that have a lot of overlaps because, of course, it's all bound together in all these topics. But it's really fun working with like a dynamic team that cares a lot about like holistic health and approaches it from all different angles to essentially improve student well-being. That is our mission in our position. And then that is an actual photo of me teaching. This was for a small workshop. I was focusing on sexually transmitted infections and just teaching the students the basics. I go to a lot of different cultural centers on campus, and there's a lot of different student groups that reach out to me that just want to have a better understanding of these things, because unfortunately there is a dearth of information regarding reproductive health, and so it's one of my passions to essentially promote that education and to hopefully improve health outcomes for students for that. So this is my contact information. Please reach out anytime if you have any more questions. I didn't have a script ready to go, really, but I'm always happy to reach out and answer any questions that you have. I remember in Professor Rad's class, we did Clifton Strengths Building, and I'm a woo and I'm an includer, so I just want to talk to everyone and answer everyone's questions all the time. So please do not hesitate to reach out on LinkedIn and also on email as well. I have my personal email and my professional email there, so I'm always happy to grab a tea and have a chat or connect over Zoom as well. So thank you.
Thank you, Zoe. Again, a splendid description of a personal trajectory through training and professional experience. And we are proud of you, as we are proud of Sagan, and as we are proud of Andrea, who's our next speaker. Andrea Villanueva is a manager of implementation at Aya Healthcare, where she leads large-scale technology and staffing initiatives with hospital systems across the country. She partners with clinical and executive leaders to improve operational workflows and patient care. Andrea previously worked in program management and health navigation roles, supporting clients with complex health and social needs and advancing community health initiatives in San Diego. She holds a Bachelor of Arts and a Master of Arts in Global Health from UC San Diego, from our program, with a focus in project management. Please welcome Andrea Villanueva.
Hello, everyone. Thank you so much for having me here today. My name's Andrea Villanueva. I am a manager of implementations over at Aya Healthcare, and I was also class of 2021 from the master's program here at UC San Diego. So 2021 was an interesting year coming out of COVID. So I actually never met anyone inside of my cohort. Some of my professors and people from the program I'm meeting for the first time here today. So very interesting times, and I'm very grateful to be back and share a little bit about my experience. Coming into UCSD and the Global Health Program, I wasn't quite sure what I wanted to do. I had my hands in a lot of different pots until the graduate program really helped solidify that program management, project management was the route that I wanted to go. Thought I wanted to work in a lab, interned at a lab, hated the lab, pivoted, thought I wanted to become a doctor. I did my field experience for the Global Health Program in Peru for about a month, spent it working there in a rural hospital clinic, and it was great. I enjoyed my time there, but it wasn't quite for me, so pivoted again. I worked at 211 San Diego as a health navigation specialist, working with different members of our community that had needs, lots of the social determinants of health coming into play at that point and in that role, but also realized that that wasn't quite for me either. Eventually, I found my way to Aya Healthcare, started there on the program management team, and now became a manager of implementation. So I'll tell you a little bit about what that is like for me. So you're probably asking yourself, well, what even is Aya Healthcare? So Aya Healthcare is the largest healthcare staffing and workforce solutions company in the US, providing talent and technology to hospitals and healthcare systems. So if you're familiar with the travel nursing space, that is where Aya Healthcare comes into place. We work with a lot of different hospitals, again, across the nation, just to make sure that they're well-staffed, and also help with any permanent placements as well. We focus a lot on the travel nurses, but we do also support in allied health, physicians, and again, that permanent staffing. Aya Healthcare is also a big proponent of technology. So we have a lot of, our technology is very much AI-driven. We do a lot of float pool management for per diem nurses, and scheduling components of this as well. So my role within Aya Healthcare is to lead these healthcare system implementations for hospitals and clinics. Again, I partner with a lot of the clinical and operational teams to improve the workflows that these hospitals have in place already. And then I optimize operations using technology solutions that, again, our company provides. So I really manage these projects from kickoff all the way through go live. So my role is really kind of at that intersection between healthcare operations and technology as well, which was not really something that I thought I was going to get into. I am by no means any coder or programming expert. Wish maybe I would have taken some of those classes in retrospect if I knew that I was going to land in this space. But it's a very kind of unique and neat place to be in that I'm in the rooms with a lot of these hospital executives while also leveraging some really cool and up-and-coming technology that's in the field. So how graduate school prepared me very much strengthened my public speaking and presentation skills. That was one of the things that, again, coming into my education, I thought, no way will I ever do anything that involves public speaking, because that's just, I wasn't prepared for it. Something that would make me very nervous, and still kind of does. But now, every day, I am spending within meetings with all these hospital executives. I'm sitting in at board meetings, I'm doing presentations, I'm doing technology demos, I'm doing trainings. So way more public speaking than I ever thought that I was going to be doing. So graduate school definitely helped prepare me for that. Epidemiology, so that's one of the key, or one of the topics that comes up very often within the graduate program. And so my ability to read and understand flu trends or other spikes within the public health kind of field that could impact hospital operations. I need to be very well aware of what is going on out in the field, so that when I come into these board meetings, I am prepared to speak to these executives as to what trends might be going on and how it might impact them directly. There were two courses in particular that really trained me into the role that I have today. The first was the Global Health 214 Program Management and Global Health class with Professor Rad. That provided me the most preparation for what I do today, almost a one-to-one translation, really. A lot of the work that I do involves gap analysis, needs assessments, key performance metrics, work breakdown structures, program timelines, communication plans, so on and so forth. All of those tools I was gathering within that class, and it was almost a little scary, actually, how much it translates into the work that I do today. You would have thought that that course was training me for my actual job, which was very cool. And then Global Health 260, Global Health Policy. So learning to read and dissect policy, law, and governance so that I am up to date on what impacts it could have on the hospitals as well. So there's always a lot of policy coming out, new laws coming out that could affect how hospitals are run. And I need to be very well aware of what's happening, not just in California, but across a lot of different states, depending on the hospitals that I'm working with. So for example, right now I'm working with UC Irvine, California, and then I have another hospital, Cleveland Clinic, that's in Ohio and Florida. So that already is 3 different states that I'm trying to navigate and make sure that I have a good understanding of what's happening in those areas so that I can be well prepared and go into those meetings with the hospital executives. One thing that I forgot to mention that I have on here is the project management tools that I learned while I was in graduate school. Trello, something that I learned in one of my kind of early classes here, and something I still use today. So there's a lot of really great information that I was able to take from the graduate program and directly translate it into the work that I'm doing today. So some advice for students, network, network, network. I also am pretty introverted, so that was something that I kind of struggled with too. But I am really happy that I put myself out there and into situations where I was able to make connections, and a lot of that opened up some pathways for me, even to this date. Say yes to projects that stretch you. So as I mentioned, there was a lot of different areas and opportunities. I wasn't quite sure what it is that I wanted to do, and so there was a moment in time where I was just saying yes to as much as I could. And some of it worked out and some of it didn't, but I'm glad that I took all of those opportunities because I was able to learn and hone in on what it is that I wanted to do in the future. And then practice translating your academic work into real-world impact. That was very much key for me, especially as you're kind of going out there into applying for positions. When I first applied to IA Healthcare, I did not think that I was going to be a great fit. I didn't have the experience that I thought was necessarily required for the role. But I was able to practice not just my interviewing skills, but taking a lot of the project-based work that I was doing in my courses and being able to relate it back to the job description. And some of the work that I did, even in that program management class with Professor Rad, was actually what ended up getting me the role inside of IA Healthcare. Yeah, so thank you so much again for having me. I'm always happy to connect or answer any questions. You can find me on LinkedIn as well. Feel free to send me a message. And yeah, thank you so much again for having me.
Thank you very much, Andrea. Again, a very clear picture of training and trajectory into a career and a wealth of practical advice. Before we started with our presentations, I gave a plug to our master's program. There's nothing that I could say that could be a better advertisement and better information and background than the experience of our three panelists today. And if this is something that you are considering, I strongly recommend that you contact our graduate student advisor, Brittany Wright, who is expert at guiding students through the application process and is a wealth of information herself. Our faculty academic coordinator is Dr. Jeff Schoenberg, and for academic aspects of this, he's also a person to touch base with if you are interested, even if you're interested in just finding out more information, not necessarily in applying. With that said, I would like to invite our three panelists to the stage for our question and answer period, and we will open the floor to discussion.
Is this on? Yes, it is on. Wonderful. Thank you each for all of those. It's such a wonderful encapsulation of like the range and type of advice that I try to give students, but hearing from people who are, in the field right now and have graduated, in the last few years, and how you've translated that is just, as Dr. Schroeder was saying, truly invaluable. I was curious in particular, just for Zoe, the FPHW certification. You didn't mention that in your process, and I was just curious because I often think, the master's program is great on its own, and people pair it with different types of other certifications and pieces. So I was curious sort of how you chose to do that and how that intertwined with your journey.
Yes, thank you so much for mentioning that. So family planning, FPHW is Family Planning Health Worker certification. And essentially, I did that throughout the past year of working in my current position. We were lucky enough to have enough funding to essentially pay for that certification. So I was able to do that on my own time. I believe I completed it last year in January. So I think it took me a few weeks, but it's super invaluable doing one-on-one counseling based on sexual and reproductive health for students, because we do touch upon topics such as family planning and figuring out what works best for their personal life journey and situation. So yeah, thank you for bringing that up. I appreciate it.
Thank you. I had a question for Zoe also. I know in the previous presentation, they were talking about how it took around 9 months to find a job placement. I was wondering if you have any difficulty with that and the certain, the fundings or limited spaces that they are.
Yes. I feel like, unfortunately, as a student in public health and someone that's going to seek a job in this field, that can be an issue. I was actually just talking to my intern about this today, funny enough, but working at a state university, the funding is a little bit different as opposed to maybe a governmental organization or a nonprofit, for example. We do seek out grants to fund certain projects that we're working on in my department, but actually much of what we do is funded by student fees, and so that naturally comes from the students, and so we're lucky enough to sort of be able to use that to create our department, and that's sort of how we were born. So I think in regards to funding, it's slightly different, but I guess that's kind of the beauty and sometimes the challenge, though, of being in global health or public health is sort of like finding the right like sector, I guess, or like professional work environment that you're interested in. I know with like project and program management, that can vary a lot too, because a lot of it is focused on a specific grant, and there's challenges that come with that. But yeah, I don't know. I would say working at an institution is really nice for that, because like fortunately we do have that continued support from the students, because we have like enough engagement from the students to want the resources that we supply them. So yeah.
Hi, my question is for Andrea. You mentioned that you did some work in Peru. Like, was that part of the master's program, or how did you get involved with that?
Yeah, so that was actually part of the undergraduate program. Field experience was a requirement for graduation. There's a lot of different ways that you can obtain the field experience. I decided to spend a month in Peru and lived in a small little town called Coya and worked with the people there inside of a clinic. So that's how I ended up obtaining my field experience. This was 7, 8 years ago. I don't remember how many hours or how much time I needed to accrue for that, but it took me about a month working there to do that. So, yeah.
Let me just say one thing about the field experience. As you know, as majors, everyone is required to do a field experience. It can be abroad or here domestically in the United States. I know it's difficult sometimes for people to support themselves to go abroad. We do have some resources to subsidize field experiences that are abroad, and I encourage you not simply to say, "Oh, I can't go abroad. I can't afford to go abroad," but please contact Jane Eichhorst, our advisor, who has her finger on the pulse of the long list of field experience opportunities and her finger on the pulse of support subsidies for going abroad. Sorry, Radhika.
No, I'll just plug really quickly. That's how I did my field experience. Was I applied to the scholarship program through the Global Health, and they were able to provide a stipend that allowed me to travel. So yeah.
I'm so happy to see all three of you up here, and to see your accomplishments and how you've pivoted so much. So with that, one, if you could give the groups here a little bit of like what's one takeaway that you would provide as an advice piece, and then two, where do you see yourself in 5 years with all the experience that you have now? Thank you.
Sounds like Professor Rod is interviewing you for a job.
It's good practice.
Gosh, one key takeaway. Well, I think my biggest takeaway, I mean, all of my classes I enjoyed very much, but your class in particular, it was like you knew exactly what I was going to do, because every skill, every project that we did in that class really is a one-to-one translation to the work that I'm doing here today. So I kind of figured that project management was going to be the route that I was going to take, so that I was particularly excited for that class. But that was my key takeaway, was just all the project management skills that I could absorb. Really helped me even now into my role. And then the second part of your question? In 5 years, gosh, I hope I'm still at Aya Healthcare. I really enjoy the time there. The company, everyone just feels like such a family, which for such a large company can be really hard, especially as a remote worker, so we all work remotely. Sometimes finding that community can be a little bit difficult, but if I'm not at Aya Healthcare in 5 years, I do hope to stay within the healthcare technology space. I think there's a lot of opportunity and growth, especially with just a lot of the new tools and functionalities that are coming out. So I hope to keep growing and learning more skills and staying, again, within that space.
I would say, as far as like a personal takeaway, this might be a little redundant to what I mentioned, but I think, yeah, just like really networking and building connections is really helpful. I think building meaningful connections with like, professors in the department is super helpful. I think was personally like really helpful for me, and even getting into my current role. I would also say just maybe, I mean, this is more specific to like community health and like impacted vulnerable communities, but I think just being in the community and being involved in sort of what's going on with them and their needs, whether that's like volunteering for different programs, or I think just being out there and grounded with community is really important too. And I know that's something that is really uplifted in the program itself. So I would say that. And then in 5 years, I hope to just maybe kind of continue growing in what I'm doing, like with, program management, project management, research, and all those things. And just, I think, yeah, maybe just like outreach in the community. Like I think growing in more of the existing kind of sort of the things I'm involved in now, I think. And then maybe perhaps like looking into fellowships in the future, things like that. I feel like that's always really helpful.
I still don't have an exact formulated answer, I think, because I have so many pieces of advice, so I'm trying to think of a sturdy takeaway. But I think something that always comes up for me is I get hard on myself, and I'm like, oh man, I want to just like have one thing that I'm gonna like put all my eggs in that basket, but I just have so many passions and so many interests in public health. And so sometimes I just think I get overwhelmed by that. And so I don't know if anyone else can relate to that. And sometimes when it comes to like choosing a career, it's like, okay, which one of these topics do I want to hone my focus on? And so I think something that's helped me is to just choose one and try something to do with that, whether that's volunteering or an internship, and just dipping your toes in that. And I think intuitively we know more than we think about like what we're passionate about. And so I look back, actually even creating this presentation, I'm like, there were a lot of connections there. Like, okay, health literacy, okay, reproductive health. And it's just kind of funny because I think everyone's more on, they're on a track more than you think. And so like continuing to like listen to your heart, but also to know that you're doing so much already, and that I think it's really just sort of trying new things, but also not overwhelming yourself with so many different topics to try. Kind of just honing in on one, and sort of to Sagan's point, like focusing on networking for a specific topic in global health that you're interested in, or seeking out a fellowship, or finding a mentor with one of your professors, or even students, I think was extremely inspirational for me as well. And I will say that Professor Rad, your class was exactly what I do also in my day-to-day as a program manager at SCSU. So I think using your mentorship and your advice and kind of to, I think it was your slide saying, taking that, the theoretical and like conceptual understandings of global health and the things we learn in class to action in our positions is actually possible with this program. And that's what I actually loved so much about this program is it's truly a career development program. I'm really using a lot of the things that I learned. So yeah, hopefully that made sense. There's, again, I have too much advice, so of course I'm lumping it all together, but listen to your heart, just pick something to focus on, try it out for a little bit, and kind of as you mentioned, like you might hate it and pivot, and that's okay. Continue pivoting, and you will find the right thing. So yeah, also networking, as I think both of you mentioned, it's not easy for everyone, and so even connecting over email and like having little baby steps in regards to networking is also just as valuable. So you don't have to get overwhelmed about meeting someone in person either, or seeking out the right, I guess, space for that, because I think there's a million different spaces that can lead you to the right people. So yes, and then in 5 years, I also love project management. I want to continue managing projects. I'm still really passionate about health literacy and education. I think education is the most important step to any change in this world, and so super into educating students. I love working with undergrad students so far, so perhaps continuing that. And yeah, I think I would love to dip my toes in research project coordination, so being a project manager for a research study I think would be really cool, kind of tying in all my passions together. So yeah.
Hi, is this working? I had a question for, is it pronounced Egan? I just was wondering how you got into your research in displacement and refugees, and also, you said you were born in Ethiopia. I was wondering if you were, or if you've ever thought of like going back there, or like conducting research, or perhaps doing like clinical work there.
Yeah, thank you for your question. I would say, as far as like how I got into like specifically like displacement and things like that, just my own personal experiences of being displaced during the war that was going on between Eritrea, my country, and Ethiopia, the neighboring country. We were sort of like annexed to them a while ago, and so just for, there's like a war for independence. It was like a 30-year-long war, and there's obviously a lot of suffering on both sides. And then there was like a peace treaty, but then a few years later in 1998, there's that border war conflict, which was a separate thing. And because of that, we ended up seeking asylum in Kenya and stayed there for a bit before eventually coming to the States. And so that experience of displacement at a young age is what really just, inspired my interest in that specific bit of like research as far as how that impacts like attachment styles and mental health and even clinical health, and also just the journey, because there's trauma like you experience within your host country, and then there's the trauma you get when there's the journey, and then like assimilating, that's like a secondary trauma. So I think all of those different points was something that was really, I was really passionate about understanding more, and then also seeing how we can really address those issues and mitigate a lot of the negative health outcomes that come from that. Like, what can we do here to, meet the needs of newcomers? And yeah, so that's kind of what stems like my overall like interest in that part of research. And then, yeah, I've always had an interest in going back. I feel like, especially to conduct, like more, research and understanding, and all of that comes, I think, of course, with something I mentioned earlier, having community be owners of that data, because we know that research has like a very imperialistic sort of history where you go into these communities and it's a very extractive process. So I think collaborating with the community and co-leading a lot of the research design and things like that, which is something I'm learning a lot in my current role. That's sort of one of our major sort of community-led principles is that. So it's something I'd love to grow more in, and eventually I think get a chance to do that there as well. I think would be really cool.
So one more panel question. I was curious, all of you guys are in positions where you've been mentored, and also now positions where you do mentoring in different ways. And I think both of those are sort of an art, actually, like being a good mentee and getting something out of that, and being a good mentor. And I was curious just if each of you guys would suggest, one thing you've learned about sort of how to be a mentee and like how to, grow from that relationship. And also one thing you've learned as you've shifted into that role also of being a mentor, about, how to be a good mentor.
I'll take it away. I think the first thing that came up for me about being a good mentee is sort of like being a sponge. And I know that's cliche and people always say that, but like truly, especially if you are interested or in the master's program, it's just a year. So like just letting it soak in completely and taking advantage of every conversation and every workshop and chats with your mentor. And asking questions, I think staying curious is extremely important as a mentee. And I think that's very helpful for a mentor as well. And now that I'm a mentor, I'm like, I love when my intern asks me questions, and it helps me learn too and grow and be a forever student as well. So I think that's what I love about that dynamic. But yeah, I think it's the sponge is the theme.
Yeah, I think that's such a great point. I would say, I think what helped me as far as being a mentee, totally agree with sort of soaking up and being a sponge to all sorts of information. I think what was really helpful for me was being honest about kind of where I was and like what I needed in the moment, or maybe like specific support I needed. I think being like honest and transparent about that was really helpful for me. And especially in sort of building that meaningful relationship with my mentor and professors. And I think as far as giving that back and supporting like youth or other interns and things like that, I think being willing to have it be sort of like to Zoe's point, like a bi-directional learning from them, creating like a safe space to be able to listen and also like just meet sort of their interests and needs, like whatever they would like to get out of the internship or what have you. I try my best, I think, to facilitate that.
I will add really quickly too, I love your point about being vulnerable about not knowing certain things and needing extra support. That's something that was really helpful for me in the program, to ask questions. Ask as many questions and don't worry about if you sound silly. Don't compare yourself to others, because that's truly the only way that you can learn. And even as a mentor, asking questions to my mentee or my other fellow mentors that I work with, my coworkers, like I think that's a really, really important and more powerful than you know, to just kind of to the lifelong learner point that I made, like There's literally only one way to learn something. And also a quote that I heard, I can't remember what movie it is now, but it was a great movie. The lecturer is only one lesson ahead of the student. And so I loved that because it's true, we can all get to that point. We just have to stay curious and keep asking questions.
Yeah, and I mean, not to, say the same thing over and over again, but it really is that important to be able to ask those questions. I know getting into the space and being that mentee, my initial kind of reaction was, well, if I don't ask questions, then they'll think that I'm just retaining the information and that will look better for me, when it's really more the opposite. The more questions that I'm asking, the more information that I actually am retaining and being able to apply moving forward. And even as the mentor now, whether that's training new people that are coming onto the team, I think being okay with knowing that I don't have the answer to everything either, and that I can lean on my other fellow teammates or fellow mentors to come in and say, hey, my person asked me this question. I'm not quite sure how to handle it. How would you handle it? And not only have I gained that experience, but I now just added a new connection for that person as well. So, yeah.
Let me just add one little thing to that. In terms of being a good mentee who evolves into a mentor, the advice, rule of thumb is show up and engage. Whether that's going to your professor's office hours and getting involved in a conversation, or whether it's being here at this kind of event. Because being here is something that can stimulate a thought process. And, that's where those questions are going to come from, right? You can't just sit there and say, oh, geez, great to ask questions, but I don't even know what questions to ask. Those questions get generated by showing up and engaging. And therefore, it's great that you all are here for that reason. Any other questions? We have one here.
How do you guys go about reaching out to nonprofit organizations and community clinics within the field? And any tips you guys have?
I would say practical answer, things like LinkedIn, but also to Dr. Shradash's point, spaces like these I feel like are so helpful. So maybe just meeting whatever you're interested in. I think it's always helpful to research maybe specific, whether it's program events or certain convenings that maybe host maybe nonprofits or anything that you're really interested in. I think it's always helpful going to those and networking there in person. But yeah, as far as nonprofit space and things like that, or even just community health clinics, I could definitely, I feel like any one of us could for sure connect with you and sort of be that open door if interested. But yeah, just again, to everyone's point, I think for sure going to those spaces and meeting those sorts of contacts and connections that you're interested in where they are, I think is helpful.
Definitely. I think something that I like to do too is sometimes I'll look up the specific organization I'm interested in, and then I think if you press people, I want to say on LinkedIn, you can see the people that work there, and then either they've had that in their work history or they currently work there, and sometimes messaging them directly is really helpful. Sometimes they have their contact information on there, like their emails, and you can always reach out to them that way. And it's just a little bit of a smaller scale connection, finding a real human to reach out to versus the company at large or the company's phone number or website or something. And then also to Sagan's point, Handshake, I think, is a really helpful job connector for students. I know that when I was a student here, I had an account, so I believe UCSD students still do, and they have really great networking workshops and different opportunities like this as well listed on there. So sometimes different recruiters will come from those spaces to campuses, so that can be helpful.
Yeah, and I think the only thing I'll add is I know when I worked at 211, we did a lot of tabling or booths at community health fairs, and that was also a great opportunity for me to go around, meet all the other clinics that were attending or organizations, the Red Cross, all these different nonprofits would attend. And again, it was just a good opportunity to walk around and meet people and see what connections or internships were available.
I think we're getting close to the end. Let me bring Suhani back up for some wrap-up remarks.
So thank you again, Dr. Shortash, for acting as our MC this afternoon. We wanted to give one more thank you to all of our speakers, of course, the community and all the UCSD orgs that participated today, our co-sponsors, and the Global Forum for co-hosting. And so this is the extra credit QR code. It's also printed out in some of the back areas of the room for you guys to scan if this isn't working for you. So I'll leave this up, and then in a couple minutes, we'll switch to the Global Forum feedback QR survey. As mentioned, we're really grateful that they've co-hosted, so please try to give them some feedback if you would like. And yeah, have a wonderful rest of your evening.